So either periods will become less, periods will become irregular, periods will become scanty, that is less than 2 days or just 2 days, pain will disappear. All these symptoms are okay and they can last from 42 to 50, 51 years. Ideally, if you are still having your periods beyond 52, we want you to get evaluated because it is not a very good sign. Okay? Then even during this perimenopausal age or perimenopausal transition, apart from less cycles, infrequent cycles, 3 ತಿಂಗಳು ಒಂದ್ಸತಿ ಬರ್ತಿದೆ, 4 ತಿಂಗಳು ಒಂದ್ಸತಿ ಬರ್ತಿದೆ, that is still acceptable as long as you are writing down or you are maintaining a menstrual calendar. But even during these days, heavy bleeding, it is always important for you to go get yourself checked because one of the endometrial lining to say whether these abnormal pattern is because of hormonal changes or illa ಮುಂದಕ್ಕೆ ಏನಾದರೂ ದೊಡ್ಡ ಕಾಯಿಲೆ ಸೂಚನೆ ಇದೆಯಾ ಅಂತ ಮುಖ್ಯ. ಸೊ ಕಮ್ಮಿ ಆಗ್ತಾ ಇದೆ, 2 ತಿಂಗಳು ಒಂದ್ಸತಿ ಆಗ್ತಿದೆ, 40 years ಆಗಿದೆ, ಇಟ್ ಇಸ್ ಸ್ಟಿಲ್ ಓಕೆ. ಬಟ್ ಯಾವುದೇ ಕಾರಣಕ್ಕೆ ಬ್ಲೀಡಿಂಗ್ ಜಾಸ್ತಿ ಆಯಿತು, ಈಗ 50 ವರ್ಷ ಆಗಿದೆ, ಈಗ ಇನ್ನೂ ಜಾಸ್ತಿ ಆಗ್ತಿದೆ ಅಂದರೆ ಈ ಕಾಲ್ ಇಟ್ TNC ಅಂತ ಹೇಳ್ತೀವಿ. ಈಗ ಮೊನ್ನೆ ಕ್ಲೀನ್ ಮಾಡೋದು ಅಂತ ಕೇಳಿರ್ತಾರೆ, ಅದನ್ನ ಈಗ OPD ಬೇಸಿಸ್ ಅಲ್ಲಿ ಪಿಕ್ಚರ್ ಬಯಾಪ್ಸಿ ಅಂತ ಹೇಳ್ತೀವಿ. 1 ನಿಮಿಷ ಕೆಲಸ ಅದು, ಒಂದು ಸಣ್ಣ ಪೈಪ್ ಹಾಕಿ ಗರ್ಭಕೋಶದ ಭಾಗದ ಟೆಸ್ಟಿಗೆ ಕಳಿಸ್ತೀವಿ. ಮೈಕ್ರೋಸ್ಕೋಪ್ ಅಲ್ಲಿ ನೋಡಿದಾಗ ಇದು ಬರೀ ಹಾರ್ಮೋನ್ ಕಮ್ಮಿ ಆಗ್ತಾ ಇರೋದ್ರಿಂದ ಆಗ್ತಿರೋ ಚೇಂಜಸ್ ಇಲ್ಲ ಮುಂದಕ್ಕೆ ಏನಾದರೂ ಕೆಟ್ಟ ಕಾಯಿಲೆ ಸೂಚನೆ ಬರೋ ಸಾಧ್ಯತೆ ಇದೆಯಾ ಅಂತ ತಿಳಿಸುತ್ತೆ. ಸೊ ಎನಿಥಿಂಗ್ ಇನ್ ದ perimenopausal age group, if there is heavy bleeding, abnormally prolonged duration of bleeding is never to be ignored. If it is getting less, if it is getting milder, infrequent, don't worry, but always maintain a menstrual calendar. One more thing we really talk about, we want to stress on is something called as HPV. HPV ಅಂದ್ರೆ ಏನು? HPV vaccine ಕೇಳಿದ್ದೀರಾ? CS cervix vaccination and the government has rolled it out now. Do you know who to give it to? 9 to 14 years, both boys and girls. See, what we want to say is every disease does not have to be symptomatic. ಅಂದರೆ ಇವಾಗ ಗರ್ಭಕೋಶದ ಬಾಯಿ ಅಂತ ತೋರಿಸುತ್ತಲ್ಲ, ವಜೈನ ಮೇಲೆ ಹೋದ್ರೆ ಗರ್ಭಕೋಶದ ಬಾಯಿ ಇರೋದು. ಸೊ ಪಾಪ್ಸ್ಮಿಯರ್ ಅಂತ ಕೇಳಿದ್ದೀರಾ? ಯಾರಾದರೂ ಪಾಪ್ಸ್ಮಿಯರ್ ಏನನ್ನು ಮಾಡುತ್ತೆ ಅದು? ಪಾಪ್ಸ್ಮಿಯರ್ ಇಸ್ ಲೈಕ್ a 30-second test. Every adult woman, every woman who is sexually active has to get a pap smear done once in 3 years. Just once in 3 years. It's a 30-second test. We are just going to put a small brush, cervix hatra, we roll it on a smear and we look for the type of cells. Why is it done? It basically detects something called as HPV virus. Why should I look for it and why should I repeat it every 3 years? Because you can have HPV virus in your body without any symptoms for even 4 decades, 5 decades. So if you were, probably some people will come and say, youngsters, adult youngsters, is one of those vaccinations which we didn't have when we were growing up. And it is something, it is the first anti-cancer vaccine and cervical cancer, which is rapid, which is the third most found in India. Okay, so that is why every 3 years you can get a HPV testing done. Meet your gynecologist, all your institutional practice, get it done, give it in person. Then one more thing, we had a couple of elderly ladies who came to us saying, ನಮ್ಮ ಅಜ್ಜಿಗೂ ಮುಟ್ಟು ನಿಂತೋಗಿದೆ, ಅಮ್ಮ ಮುಟ್ಟು ನಿಂತಾದ್ಮೇಲೆ ಯಾವತ್ತಾದ್ರೂ ಮತ್ತೆ ಕೆಂಪಟ್ಟೆ ಕಾಣಿಸ್ಕೊಂಡಿದ್ಯಾ? ದಯವಿಟ್ಟು all of you please bear in mind, we say menopause. Pause is not a pause, it is stop actually. For a whole year, she could not have had any form of bleeding, not one drop, not one stream, not one dirty brown discharge. Then we call that woman a menopausal woman. Any pattern of bleeding, once a woman reaches her menopause, she should not bleed. But for whatever reason, if any elderly person in the house says they had some bleeding, they usually don't come and tell you because either they are embarrassed or they say maybe it will stop. It will stop. And by the time they actually come to the doctor, things are bad. When a woman reaches menopause, any woman having bleeding, again, probably she's not had a period for 1 year. 2 years later, she thinks she is menopausal. She gets some amount of bleeding, heavy, normal, or very little. That definitely is never normal because in the elderly age group, when they are going to have a normal pattern of bleeding after menopause, the most common cause is cancer. So even the elderly people in your house, ಅವರು ಹೇಳಲ್ಲ, ನನ್ನ ಹತ್ರ ಹೇಳ್ಕೊಳ್ಳಲ್ಲ, ಮುಟ್ಟು ಮೈಲಿ ಅಂತ ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ನಿದ್ದೆ ಹಾಳಾಗೋಬೇಕು, ಇಲ್ಲ ಆರೋಗ್ಯ ಹಾಳಾಗಿ ಇಲ್ಲ ಸರಿ ಕೆಲಸ ಮಾಡ್ಕೊಳಕ್ ಆಗದೇ ಇರೋದು ಅವರು ಮನೆಗೆ ಬಂದು ಹೇಳಲ್ಲ, ಏನೋ ತೊಂದರೆ ಆಗ್ತದೆ ಕರ್ಕೊಂಡು ಹೋಗಿ ಅಂತ. ಸೊ ಇದಕ್ಕೆ ಓಪನ್ ಟು ಯುವರ್ ಮದರ್ಸ್ ಆಲ್ಸೋ ಅಂಡ್ ಸೇ, ಅಮ್ಮ ಏನಾದರೂ ಮತ್ತೆ ಬ್ಲೀಡಿಂಗ್ ಆಯಿತು, ಏನಾದರೂ ತೊಂದರೆ ಕಳಿಸಿ ಹೋಗಿ ಚೆಕ್ ಮಾಡೋಣ. So many times when we talk to patients, I really want to tell the women, we know we are dealing with a very personal area, okay, and even the history we talk, whether it is infertility or periods or sexual history or whatever, is very sensitive. Do not ever be embarrassed to give a complete picture. If you had an abortion or an IUD or how many noises have happened, whether you are able to have sex with your husband or not. Because when you come to saying, I'm not able to have children, but you are concealing history, whether it is painful for you, not painful for you, how will you be able to proceed and guide you correctly? And especially always remember, you always ask about family history. So family history of any breast cancers, any uterine cancers or ovarian cancers, it is very important for you to know. Because if you do not know, evaluated at least once a year. Sometimes ನಮ್ಮನೇಲೆ ದೊಡ್ಡವ್ರು ಹೇಳ್ತಾರೆ ಚೆನ್ನಾಗಿ ಏನೋ ತೋರಿಸಿದ್ರೆ ನಮ್ಮ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗಿ ಅವ್ರು ಏನೋ ಹೇಳ್ತಾರೆ. Don't you want to know if something is wrong, or do you want to wait till it reaches a stage where treatment is not going to work? See, we always say we are well, the nerves, but something will be your. So you might as well screen yourself, and always remember, when you know what is a normal pattern and what is an abnormal pattern, and not saying be very vigilant and get scared, and the first month that something is mediated, you get scared and you get paranoid and not to the doctor. But at any point of time, if more than 2 cycles, more than 3 cycles, the abnormal pattern is persisting, please go to the concerned specialist, not Amma, not Aji. You tell her if you didn't know you are lucky, you come to me, let us go, get ourselves checked. Always remember, a diagnosis is not made only on one complaint or one report. It is always examination, seeing all the reports, seeing the background risk of the patient, seeing if there is any significant family history, how bad has the complaint been affecting the current health, and then we will proceed. So the only thing is correct, move to ಮೈಗೆ ಬಂದು ಯಾವ ಅಬ್ನಾರ್ಮಲ್ ಯಾವ ನಾರ್ಮಲ್ ದಯವಿಟ್ಟು ನಾಟ್ ಇಗ್ನೋರ್. ಇವಾಗ ನಿಮ್ಗೆ ಆಗುತ್ತೆ ಅಂತ ಅನ್ಕೊಳ್ಳಿ, ಆದರೆ ನಿಮ್ಮ ಫ್ರೆಂಡ್ಸ್ ಯಾವ್ದು ಇರ್ತಾರೆ, ಏನಕ್ಕೆ ಒಂದ್ಸತಿ ಮುಟ್ಟು ಕಾಣಿಸ್ಕೊಂಡು ಕಣೆ ಪ್ಲೀಸ್ ಹೋಗಿ ಚೆಕ್ ಮಾಡಿಸ್ಕೊಂಡು ಮುಟ್ಟು ನಿಂತಾದ ಕಡೆ ಮತ್ತೆ ಮುಟ್ಟು ಕಾಣಿಸ್ಕೊಳ್ಳೋದು ನಾರ್ಮಲ್ ಅಲ್ಲ. ನಾರ್ಮಲ್ ಅಲ್ಲ ಅಂತ ಹೇಳೋದಕ್ಕೂ ಮುಖ ನೋಡಿ ನಾವು ಹೇಳೋಕ್ಕಾಗಲ್ಲ. ಇಲ್ಲ ಸ್ಕ್ಯಾನ್ ಮಾಡ್ಕೊಳ್ಳಿ, ರಕ್ತಕೋಶವಾದ್ರೆ ದಪ್ಪ ಪರೀಕ್ಷೆ ಮಾಡಿ ಹೇಳೋದು. Okay, so I hope at least on a general level I am able to connect with you all about what to expect, what not to expect, and when you will have to get yourselves and meet your doctor. Then, okay, thank you so much for listening.
फाइनली हो गया। तुम ज़रा मेरा रिकॉर्ड कर लेना, मैं ढंग से बोलूँगी। वोट ऑफ थैंक्स है मेरा, वोट ऑफ थैंक्स रिकॉर्ड कर लेना, मैं ढंग से बोलूँगी। ऐसा है क्या? हमारा भी है क्या वोट ऑफ थैंक्स बोलना? तो रिकॉर्ड तुम ही आगे बैठी हो कर। ओहो, जल्दी बोल रही हो, घबरा रही हो गया तुम्हारे को पूरी नॉलेज में?
क्यों नहीं हो रहा है भाई?
मैं तो चलती खड़े रहिए, मतलब खड़े